Okay, thanks for staying through the end. This is the last session, session 5, planning for upstream impacts. Just as I was just saying at the end of the last one, we've had in public health an overemphasis on downstream efforts. And our healthcare system also reflects this, right? We typically see patients when they're sick, and that's when we treat them, not necessarily on the front end in the preventive space. Our state and local public health efforts, have also been kind of focused on this downstream perspective. If people are homeless, we try to connect them to shelter. If they're hungry, we try to connect them to food. If they need health care, we try to help them connect to access to care. If kids are hungry, we try to create school lunch programs and backpack buddy programs with summer supports. Is there anything wrong with any of that? Absolutely not. Please don't stop doing any of those important things, right? So we really do need those, and we need to always constantly be tweaking and improving them so that they're as effective as they can be, and that so resources are distributed equitably, and that there's quality control happening to ensure that the services and programs are operating in ways that are consistent with best practices. But as I said before, the problem or the imbalance is that, we've gotten so good at downstream efforts that we've actually trained our funders to create RFAs that only ask for proposals for this kind of work. And over time, leaders are realizing that they also need resources in addition to focus on upstream efforts that will hopefully reduce the demand for these services. So part of the concern that we've seen in maternal child health is that eventually to shift gears to more upstream focus means that we might use our resources differently. We might structure our programs differently, which can eventually change the responsibilities of individual roles. And this brings us back to the need for leaders to have excellent change management skills, right? Because that stirs up a lot of feelings. There's a lot of conflict in making those difficult choices. In some of my MCH work, I've seen state teams change their focus to move down the pyramid, that concept of moving away from direct services and more to strategy work. This means that some of our direct service positions, are being moved out to vendor organizations, and some of the staff follow, but that's not always the case. There's also opportunity to retrain and build capacity of existing staff to do new things as well. So the controversy piece of shifting upstream can be about internal controversy just as much as it can be about the external facing work. So why is this so hard? It's so hard because there are political elements to this work, and it's more controversial. And when I say less scientific, I just mean that it's not as easy to draw a cause and effect or to map out what we think the outcomes and results are going to be. Describing potential long-term impacts is a little bit more abstract for a lot of people. So more political, right? So let's start there. When public health got serious about reducing smoking, they had to go up against big tobacco. When public health wants to reduce shooting fatalities, they have to go up against powerful gun lobbyists. In some of the equity work I've done with leaders, in order to reduce the amount of minorities being incarcerated for accessory crimes, they had to address norms created out of the prison industry. I was part of a workshop a couple of years ago, and in one of the exercises, one of my mentors did a power analysis in front of the room where she elicited feedback from a really diverse group of stakeholders in the audience, very, very divergent perspectives. We were looking at the problem of opioids and the systems that consciously and unconsciously benefit from the problem of opioid misuse. And using that word benefit from was very uncomfortable for a lot of people. It was really surprising to see, or maybe, again, the first one wasn't so surprising. We all kind of knew Big Pharma was benefiting, right? I think everyone kind of agreed on that. But then it got a little trickier when we started talking about how the local police had to increase their staff to address this issue, and so that they were benefiting is maybe not the exact right word, but there were, they would have, if we solved this problem, right, then that would create some potential conflict there. There were a lot of rehab centers that had popped up in this particular community, and the people that work there were getting grants and getting funded and were creating jobs to support the people who were addicted. The EMTs, we had to increase the workforce for EMTs had to be increased because there were such a plethora of EMT calls related to opioid misuse and drug use. And even the health departments themselves were receiving grants for opioid related work. So just in that room, naming the fact that we were trying to work ourselves out of a job was a little bit uncomfortable for some. So that was just something we needed to kind of put out there. All we're expecting that jobs and growth to keep up with the managing or sustaining the problem itself. They all thought that this was going to kind of be the way forward, was kind of going to be continued growth and increase in those things. And the thing is that anytime public health gets in the way of profits or jobs or anything like that, we're going to ruffle some feathers. So I'm just asking you to consider looking at maternal child health nutrition. What are the systems that might anticipate losses in one way or another if food deserts were eliminated? If school lunches were made more accessible and fresh and tasty? What if families gained more economic power and needed food stamps less? Or kids and adolescents stopped eating fast food? What systems might have a loss with that? What if families stopped purchasing soda products? What if built environment improvements made families less reliant on public transportation and indoor recreation such as video gaming? Who might lose profits there? What if hospitals and birth centers promote breastfeeding first before offering formula and don't send mothers home with formula samples and coupons as the norm? So you know the answers to all the things I just asked you, and I know that. But it's just it's thinking through as you're moving through this kind of work, really spending some time saying out loud, that there are systems that may experience losses or threats or some other sort of negative consequence if this work actually happens and is successful. And that might not be a bad thing, but just thinking through what are the potential roadblocks that we might experience. And I think looking at the smoking and tobacco industry example from the past is a good one for us to keep in mind. So more controversial, right? We know that upstream work is harder than downstream work, but the potential wins are worth the extra effort and the challenge. And as I've worked with leaders who have made this difficult shift, they are sometimes caught off guard when situations arise. And suddenly they're not only having to defend the work, but actually having to defend their own priorities and decisions. I only tell you this to encourage you to bolster your own skills in developing thick skin and courage to do what isn't straightforward and linear. Remember, we talked about the different leadership levels and how there's more conflict, there's more challenging dynamics to navigate as you move to those upper levels of leadership. And I think just understanding that that's the norm and that's what to expect takes a little bit of the edge off of the challenging feelings that everyone feels as individuals with that. In my own state, we have a very conservative General Assembly. A while back, a group came together representing multiple political perspectives and decided that a needle exchange program was a necessity given that Hep C rates were going through the roof in some of our rural communities. And in order to get legislation for such a typically controversial topic, a concerted bipartisan effort took place. And each voting legislature was literally visited and talked with, not to, by someone who could discuss these topics, these ideas in a way that resonated with them. And it wasn't just delivering a message, but instead it was a true engagement of asking questions and providing validation for efforts that person had already participated in, that had worked. And there was all this nuanced way of doing that level of advocacy that was more about engaging with that person instead of delivering a message, if you will. So those are two very different things, and that's called mutual learning. Roger Schwartz is a great author on that, if you're wondering. What was really interesting about that, I learned, is that they were, I knew they were successful. I had heard about it, but, other states had been coming to us going, how did you do that? Because they knew that our legislature wasn't typically open to controversial ideas like needle exchange programs. But it was really through extensive relationship building and trust building that it took place. And I think that's the lesson I learn over and over and over again with this kind of work. I worked with a couple of leaders who were really focusing on the equity divide, which was literally the most extreme in the entire country. And they were trying to shift from using time-delayed state data to having accessible neighborhood level data at the ready to inform the design of strategic approaches. So thinking through using all those systems thinking tools that I just showed you, if they had really great data on that neighborhood level from the end users themselves, wow, that's going to make a big difference, right, in the design of the interventions. So the trick that they had to do is that they had to ask community clinics to hand over their patient data. That's not an easy thing to do, right? Nobody wants to just hand over their patient data. But you know what? They, again, just like with the needle exchange legislation here in my home state, they invested in relationship building and trust building efforts that take a really long time. They focused on the why part of the change process. And by doing that, they were able to be successful. And now, like a year and a half later, since they made that kind of success, because like I said, it's 2, 3, 4 years, right? Now we're, I think, 2.5 years in. Now I'm happy to tell you that they were working really extensively in affordable housing in their community, in an area they had never even really worked in from a public health perspective, because they learned through that experience with the neighborhood level data that was going to be the issue that they needed to focus on to actually move the dial towards more healthier outcomes for a lot of the populations that they serve. So anyways, I just get really excited talking about those examples, but I hope that they were helpful to you. And then related to that is this concept of advocacy, right? So we just talked, the legislation piece, obviously that's advocacy. So public health seeks to create an environment in which people can be healthy, which involves the often contentious process of blending science, politics, and activism in the context of social values and interests. That's a quote from the reference there on the slide. So that basically means, to me, you have to cook the conflict, right? You have to get comfortable with that. You have to get comfortable with that piece of it. I've been working with 2 leaders in a rural area who realized that to have the effect that they wanted in children's health, they needed to work further upstream, and they had to get the policy supports in place that would provide consistent early education in their community. They realized that this work needed to be done on the state level first before it could have an effect in their community, just by the way that their state is structured. And so they developed their advocacy skills, and they were really successful in helping to get universal kindergarten passed in their state. And now they're working on universal preschool. And the way they're going about it this time is that they're building the capacity of their allies and other partner organizations, because they're just a small agency. And they're building their advocacy skills, how to write letters, how to make phone calls, how to show up at certain events and speak one-on-one with people with voting, with legislative voting rights. So now they're able to advocate, they themselves and their partners are able to advocate on both the local and state level. So that's why I put who me, right? Like, I didn't sign up to do public work, to do advocacy work. Most people didn't. Most people wanted to design and implement programs and services, right? But we're learning that in order to be effective with this upstream work, we need to think back to those leadership domains that we highlighted earlier. Remember, I said we don't always have a lot of folks in that influencing domain. So intentionally developing our capacities in that influencing domain is really, really critical and important for us to be effective with doing work at that policy, environmental, and systems level. So why is this really hard? Well, shifting to upstream is harder because you can't accomplish a lot of it on your own within your own organization. It's more complex, and it relies on leaders' abilities to apply buffering and other relationship building techniques with partner organizations that are familiar to us, and some that aren't. But it also requires stretching beyond to organizations and corporations, even, and systems like healthcare systems, entities that we're not used to working with, right? And that's really not typical for us to work with them in our current downstream work models. So it's really doing different work, different ways with different groups, And so that means we have to find common ground and common language for our shared interests. Complex collaboration and collective impact efforts take an enhanced leadership skill set, that include advanced communication skills, right? We've talked a little bit about that, but that is probably the most important piece. But also developing creative funding streams, as we already mentioned before, and a shift from focusing so much on near-term outcomes and shifting more to those long-term impacts. There's a group in Atlanta called Archie, ARCHI. They're a really unique collaborative that I've, just kind of gotten to know through some of my leadership development work. They've been a great model for a lot of our leaders. We've brought them in to speak to people from time to time. And basically it was a group of partners in Atlanta that had just grown frustrated at living in the same city as the CDC, and with a great school of public health and, a wonderful institute for public, they had so many great resources, but yet their resource-rich community, there were still these really persistent health inequities, and they were getting worse despite years and years of investment. So back in 2013, they formed a collective that they decided to focus on generational impacts. And they set their outcomes out to 28 years. Yes, you heard me right, 28 years, because that's a generation. So that's how they did it. And they have over 70 partners, and all of them pay in one way or another to this collective effort. They've identified 7 priority areas. For them, it's encouraging healthy behaviors, family pathways, coordinated care, global payment, which is kind of an interesting concept, capture and reinvest, another interesting financial concept, expanding insurance, and innovation fund, which is what allows them to try new things. I love learning more about that innovation fund. So they actually are succeeding already in reducing healthcare costs, reducing non-urgent visits to the emergency room, and also reducing hospital readmissions. They've also learned that worker productivity has gone up, as has access to preventive care for chronic disease. So they're making some pretty significant headway. The way that they've set up their framework is to have an unbiased platform. So that means that solutions aren't always found within the healthcare system, but within the community itself, which we love in public health. That makes a lot of intuitive sense to us. They incentivize groups working with unlikely partners with lots of facilitative support. That means like both showing up and facilitating meetings, but having tools and processes to help them along the way as well. They're interested in constantly surveying for innovative models, not just where they live, but like in the larger whole of the country and maybe even beyond the country. And they like to test them out and see how they could work in their context. And the collaborative has gotten really good at helping the partners demonstrate the mutual benefit for both them and their home agencies. And that's a really important communication piece for resource investment on a continual, sustainable, constant basis, right? So they've gotten really good at things like data collection and impact measures. And what else? Let me see, memorandum of understandings, joint funding agreements, and things like that. So I share these stories only to provide inspiration and to let you know that there are mavericks out there looking at the problems that they want to solve from adaptive lenses. They're working to solve the strategic questions and not solely focusing on the technical ones, but it's not easy. Less scientific, that was the third one. And that basically just means, we can't show outcomes and results as easily as that's easier to show than showing long-term impacts that take a long time and feel more abstract. So as strategies and subsequent activities and interventions become less tangible and perhaps more abstract, like I just said, it becomes less clear to funders and stakeholders what the cause and effect is, and the distance between cause and effect gets wider. In one of my roles, I've been helping the leaders of local health departments across the country who want to create a new role for their agency, address a priority issue or issues in their community. Something that's just an idea or a concept at first, but that can actually move the dial if it works out. So almost all the role transformations have centered around something that addresses upstream factors and systems. I've worked with several teams that want to actualize concepts behind that term chief health strategist, which a lot of people don't like that term, so I'm not advocating for the actual term, but just so you know what I'm talking about, into reality in a way that's meaningful in their own contexts. I've also worked with public health leaders who want to reimagine the child welfare system by putting a preventive lens on the way that all children are actually brought into the system, so that minority children are not involuntarily put into the foster care system at higher rates based on bias. So they've figured out ways to remove the bias, which is kind of neat. As mentioned before, I've helped leaders disrupt generational toxic stress. That was that rural group that I mentioned earlier, and they have found a way to integrate primary care for kids with behavioral health in very unique ways, which has made a really big difference. I've also helped leaders create mobile mental health systems that respond to emergencies to decrease the number of ER super users and place public health professionals in the local jail. So as inmates are transitioning back to community and are released, that they have the supports in place to disrupt the cycle so they don't end up back in jail later on. I've also been working with leaders who've created like an internal lab of sorts within their own agencies. And what they've done with that, those are like health equity or equity labs. And they've invited other organizations to kind of come in and do facilitative collective work with them, kind of similar to the Archie model, but it's like using some of those systems tools to really carefully look at existing systems, particularly ones that perpetuate inequity, and finding ways to dismantle them and rebuild in ways that are more equitable. In all of these, and even in more examples, they're very these are all really different streams of work than all these leaders were typically used to doing prior. And it's also different than what their funders were typically used to. So some of the biggest feedback that we've gotten from these leaders was some, really deep gratitude for enhancing their ability to think adaptively and give them supports along the way and imagine how work could be designed differently. They shook up their own status quo of how they approached their work and deliberately moved away from downstream programs and services and shifted towards the upstream ones. It's not easy, and it takes time and support and effort. The other biggest feedback that they provided to us was gratitude for some flexible funding from the foundation that supports the program. And that is, they definitely have given us a very clear message, that we need to be informing and educating our funders that we need more flexibility so that we can do this upstream work well. So they've asked us all to kind of stress that importance of structuring funding opportunities in ways that don't necessarily require a linear, drawing of how we're going to actually get from intervention to outcome. So those are just some things that I learned. So I just put this book up here just to kind of give you a great reference tool if you don't have it already in your collection. We use it a lot in personal leadership development programs. And it goes over these 5 sort of foundational principles of personal leadership development: modeling the way, inspiring a shared vision, challenging the process, enabling others to act, and encouraging the heart. And because change is the thing that I love to talk about most, you can see how this is really nice, is nicely in alignment with that kind of work. But I think it's really important for this session to talk a little bit about the challenging the process piece, right? Because that's kind of what we're talking about by shifting from downstream to upstream. You can see how all the things we've already talked about today kind of touch on one part or another of these different foundational practices in leadership development. And when you're shifting the focus on any area from downstream to upstream, you are actually challenging the process, right? You are asking for others to consider to do things a different way. And as you go about that important work, you're going to need to communicate that why very, very well. For some leaders I've served, the why has connected to relevancy, right? Their organization was losing relevancy in their community, and they knew that they had a special skill set that wasn't being developed or utilized as fully as it could be. So that's where we focused. For others, it's connected to a frustration that the same approach is only getting results that go so far, and they're interested in pushing further. And I see this a lot in the leaders who are frustrated with persistent inequities. And in some cases, they feel like the downstream approaches are more of a band-aid solution or a stopgap measure. And they know that to really make progress on the problem, it's going to take a whole different approach. You knew I was going to put a picture up of the fish going upstream, right? So shifting upstream, it's different. It's why is it hard? It's because it's different, right? Different is new, and new is different, and change is hard. It uses new approaches in planning and problem solving, so we can't use those quick mental models. We have to stretch and push ourselves to do new things. I can't tell you, I'm going to tell you a little secret. I didn't understand causal loop diagrams for the longest time, and I'm surrounded by all these brilliant people, right? All these academic brilliant minds, and I think I heard it 3 times, and I finally went up to Dr. Hesmiller-Lich. I was like, I don't get it. Something's wrong with me. And she sat and she talked with me for a little bit, and I did finally get it, and now I actually help other people, but it was hard for me. It was hard for my brain. My brain works a little bit more linearly, so it was a little bit hard for me to figure all that out. But we all have to stretch ourselves to be able to do this kind of work. It's hard because there's such a deep emphasis on communication, and communication is probably the hardest part of everything related to those higher levels of leadership. So I think that's partly why it's hard too. And there's limited examples in its application. So, being a maverick or an originator in this area is challenging as well. We also don't have a ton of evaluation. We're starting to get more though. It's getting more encouraging. So here are just a couple of tips as you try to maybe embrace this way of thinking and working and approaching. You want to make sure that you're always asking questions from a place of curiosity. Well, what made you think that? Or I'm really curious about your thinking, or can you share with me your perspective? Or, help me see my own blind spot in this. There's all these different ways you can kind of show curiosity, but coming to conversations and to engagement from that place really is extremely helpful. Again, don't do it in a vacuum. Don't do it with the usual suspects around the table, but really engage with the end users of whatever it is that you're trying to solve and the people that influence them or are advocates for them. And then wear that prevention hat proudly. When I'm working with those leaders who are trying to put a prevention lens on the child welfare system, which most people would think, well, that's not even our territory. That's not even public health. But we're the experts in prevention, so they wear the prevention hat and can apply it to any sector, right? That's what we're doing with some other sectors like the criminal justice sector, for example, and many, many others. So just remember, that's your, you can wear that you're the experts in prevention. And be patient with yourself and your collaboratives, because results do take longer. And again, I can't emphasize enough how to celebrate those small wins and mapping them out and really seeing those as really important mileposts along the way. And this is just great practice for mutual learning. It's just building in lots of opportunities for reflection so you can refine as you go. And I know that's best practice even for our downstream work, but it's just so critically important. And I sometimes see it getting missed in some of our upstream efforts. So building purposeful, intentional time and effort for that is really key. So we've talked today a lot about considering who you're trying to reach with your work, right? Also thinking beyond to who your end users, influencers are, and who likely and unlikely systems level partners might be to help you tackle your challenge. So a lot of different discussion today about who. And then there's the challenge itself. We talked about how to make sure your work is focused on the right strategic questions. I'm always amazed at how doing that exercise in group settings, the majority of participants continue to write technical questions instead of adaptive ones. I know I mentioned that earlier, and it's because it's hard. So try to get a buddy to work with and give you some feedback using that criteria that we discussed. Make sure you're focused on the right questions that you must address. Otherwise, the consequences would be dire, right? And we walked through a series of system thinking tools to help you look at your challenge from lots of different angles to assess and to analyze so that finally you can pinpoint what the what is that you want to collectively focus on with partners and stakeholders. And using tools like the 5 R's, the objectives tree, the impact matrix, should help you decide where to start for maximum impact and feasibility. We talked about the change process and the importance of investing effort into explaining the why behind your idea for change in many ways, at many times with many people, right? It's not good enough to just put it in one newsletter or give one PowerPoint presentation. Got to hear it from lots of people, lots of different ways. And finally, the systems thinking tools can help reveal the best way forward, or at least the first way forward for shifting from a downstream focus to an upstream one. And at last, here are some more tools for you, some resources on the MCH Navigator that I hope will be helpful to you as you move forward. I want to thank you again for your attention. I really appreciate the opportunity to talk with you. Maternal child health leaders are very special to me, very close to my heart, as is nutrition. So I have a lot of my roots in public health there. So I just want to say thank you for the important work that you're doing, and thank you for attending these sessions. I wish you absolutely all the best. Please do feel free to connect with me on LinkedIn, become a friend. I would love to hear from you, and be well. Thanks.